everyone. My name is Shania, and I'm a physiotherapy resident here with Zoomers Physiotherapy. And welcome to the presentation on low back rescue. So a little bit about me. I graduated with a bachelor's of kinesiology in 2017. I then went ahead to do my master's in physiotherapy at Dalhousie. And I've been a resident and working with Zoomers since November of last year, and I have been loving it. I'm a proud Newfoundlander, but I quickly fell in love with the beautiful province of Nova Scotia. And most importantly, I have a huge passion for helping individuals either start or remain active as we age. So the planned takeaways for today's presentation is to have just a better understanding of some of the common factors involved with low back pain, how to set yourself up for success to avoid or manage your low back pain using some of the recommended tips that we're going to give to you, and also how exercise can help with your low back pain now, but also in the future. All right, so the planned program for the presentation today, we're going to start with some statistics. Very briefly, we'll go into some common risk factors. Then we'll touch on some education on the prevention of low back pain. So that'll be the recommended tips. We'll have an exercise demonstration. I'll show you some of my favorite exercises for low back pain, and then we will wrap it up at the end. All right, so again, starting with some statistics, did you know? So 50 to 80% of adults will experience low back pain at some point in their life. It can affect people of all ages, so from younger children all the way up to older adults. The cause is usually complex and involves multiple contributing factors. So due to its complexity, the natural history of low back pain is quite variable. So the pain can last from a couple days all the way up to many years. So again, very variable due to the complexity. Fortunately, most people do recover. Research has shown that new onset of low back pain, they usually recover. However, it can reoccur, and we do know that it can persist and become chronic. And again, even with reoccurrence, it can be managed with the proper education and the proper physical activity. So starting with a quote, prevention is better than cure. So very, very true. Today's presentation, we're really going to focus on preventative measures and the materials just to be used as a education resource to just increase your knowledge about low back pain. I very briefly will mention that pain is very, very complex. Low back pain in particular, it's a very multidimensional. So it's influenced by our emotions, our sleep, our social factors, our psychosocial factors, our physical activity, our genetics, et cetera, et cetera. So everyone is different. So it's also very likely that everyone's pain is different. So just keep that in mind as we go forward. Okay, so again, keeping the complexity in mind, there are some risk factors that have been identified. The first one being age. So the prevalence has been shown to increase with age until about 60 to 65 years old, and then it gradually declines. However, it's still a well-known issue. It's still a big issue with older adults, as it can affect up to 36 to 70% of older adults. So still a large number for sure. Other risk factors including low educational status, heredity, smoking, physical demanding job, and psychosocial. So again, I had this one starred. This can include depression, anxiety, fear, stress, all that can influence pain. And it's also been shown that these psychosocial factors may be associated with the progression from acute low back pain that transitioning into chronic low back pain. So again, important to keep in mind. Some of the common risk factors that we often see in clinic when people book an assessment or they come in with a new onset of low back pain may include posture, so primarily prolonged posture, incorrect lifting or bending, and a decreased strength or physical activity. So prevention, what are some things that you can change or maybe start today that can help manage, that can help you prevent or manage low back pain? So here we're going to get into those recommended tips. So our first one, our sitting setup. So a lot of us are working from home right now due to COVID. So we likely are doing a little bit more sitting than we might be used to. So some helpful tips that I often give to people for their sitting setup, which our physio Maggie here is being a great model. So these tips can just help lessen the stress on your muscles, but also on your joints. So a few tips here, I often recommend that your feet are flat on the floor. Your knees are bent at 90, as you'll see hers in the second picture there. And then you want your hips either in line with your knees or slightly above the knees. So you'll see Maggie here sitting on a cushion just to bring her hips up just a little bit. And then you'll also see my fancy technique of a rolled up towel placed along her low back. And what this does, it just provides some support to that low back, and it just encourages the natural curve of your spine. So again, can be comfortable when you're doing some sitting. Two last things is that ideally you want your elbows bent to 90. We don't quite have that here with Maggie, but close. And the second is that having your screen at eye level would be helpful as well. But again, we didn't have that option for Maggie here. Tip number 2, so you can have the best setup at home. However, you still need frequent breaks. So the main thing I'm going to try to get across here is try to avoid prolonged static postures. So give your back a break. So standing is an excellent break from sitting, but sitting is also a good break from standing. So again, anything to kind of get you up moving, everything in moderation. So again, some helpful tips that I often recommend to people is set a timer on your phone, maybe every 20 or 30 minutes to get up and get moving. Keep your phone or your water bottle on the opposite side of the room, which forces you to get up again every half hour, maybe every hour, again, just to move your body. Walk around your chair every once in a while, do some sit to stand exercises, which we'll go over in a minute. And if you have the option, walking on your lunch break, that would be excellent. Okay, bending and lifting. So learning how to lift and bend can be super beneficial just to ensure that you're using your body efficiently and safely. So often what I'll do with clients is to have them work on progressive strengthening exercises that look a lot like the bending and lifting motions that they do in their everyday life. This way, you're going to strengthen the muscles. You're going to learn how to turn on those muscles and prevent yourself and protect yourself from injury. So for example, this is a single leg hip hinge exercise that Maggie's doing here on the side. It looks a lot like the act of picking up a small item from the floor. So again, a great way to strengthen the muscles that are involved in that movement. On the bottom here, we have some recommended tips. So if you're lifting something more heavy, I'll often encourage a wide base of support. So standing with a wide stance, squat down by bending at your knees and your hips, thinking about your posture, and of course, holding the object close in towards your body and not out far away. All right, so what about core strengthening? We hear lots about core strengthening and back pain. But first, what is the core? So our physio, Maggie, actually did a presentation just focusing on core. I think it'll be on our YouTube channel in a few weeks. So if you do want to know more about specifically core, definitely watch her video. But the main message I want to get across here is that our core includes more than just your ab muscles. So those six-pack ab muscles, it's more than that. So it's those muscles, definitely your abdominal muscles, also your back, your hip muscles, your glute muscles. Um, that's all involved with the core. So having good strength in our core allows us to move well. And if we progressively strengthen these core muscles, we just increase the load tolerance of our body. So again, we can do more, we can lift more without injuring ourselves, and just by increasing the resilience of our body to do our day-to-day task. There was one study that showed that core stability training may be effective in decreasing pain and improving function in the short term. So if you do have a new onset of low back pain, core strengthening may be a really good place to start. All right, so what about long term? So if you're going to take anything away from this presentation, take away this slide here. So exercise, if there's any magic pill or if there's any rescue, like the title of this presentation, it is exercise. So exercise can reduce your risk of low back pain. It can reduce the intensity of pain, and it releases endorphins. And we know that that is a natural painkiller. Also circulating back to the common factors that influence pain. We know that anxiety, stress, depression, our sleep, all of that influences pain. But there has also been oodles and oodles of research that has shown that exercise can improve all of these factors. So really, it's a win-win. Okay, so how much exercise? This here is the Canadian Physical Activity Guidelines. So between the two age groups, they're actually pretty similar, few minor changes, but overall you want at least 150 minutes of moderate to vigorous aerobic activity for both groups, strengthening at least twice a week. And then for 65 and older, they also have some balanced exercises included here. So super important. Several hours of light physical activities throughout the day, including standing. So that is very important. Our sleep. So again, I love that they have sleep here because we know that sleep is one of the factors that influence pain. So 7 to 8 hours for 65 and up, 7 to 9 hours for 18 to 64. And then this last point here, which is very similar to what I was mentioning earlier, is limiting the time that you're sitting still or staying still. So they have mentioned word for word, breaking up long periods of sitting as often as possible. So that all comes back to the frequent breaks, setting your timer, putting your phone on the opposite side of the room, whatever gets you up and moving when you know that you're going to be sitting for a long time. All right, so we're going to do an exercise demonstration here next. We're going to start with two strengthening exercises. We have the sit to stand and the hip hinge. So both of these exercises, they strengthen our lower extremity muscles, our back muscles, our core, like we mentioned, and it helps strengthen the muscles that we use when we sit out from the toilet, when we go up the stairs, when we're walking. So very beneficial. So I'm just going to stop the share so I'm nice and big. There we go. So the first one here that I will show you is the sit to stand. So if you have a chair nearby, grab your chair. Ideally, you want something that's not going to roll away on you. I would even suggest placing it up against a wall so it doesn't shift as you do the exercise. But first, sitting towards the edge, you're going to take both your hands here, create two fists between your knees, and then you're going to place your feet underneath your knees straight down. You're going to cross your arms over your chest, and then you're going to stand up and sit back down. So on the way up, you want to imagine like you're pushing through your heels and squeeze your bum muscles. So again, up and down. One common mistake, or not even, sometimes it's a habit that people have when they come up, their knees will fall inwards. So really make an effort to keep that 2 fist distance between your knees as you stand up and as you come down. All right, and then the second exercise was the hip hinge. So I'll often get people started if you have a golf club or a broomstick at home, grab that and you're going to place it behind your back. And you want the top of the stick touching the back of your head and the bottom of the stick touching your bum here. Standing up, you're going to relax your knees. And then you're going to bend forward, bending at your hips. So keeping your back nice and flat. And then come back up. So it's just down and up. So it's a great strengthening exercise, but it's also teaching you how to properly bend forward. So as you come down on the way up, you want to, again, squeeze your bum muscles. So up and down. All right, so that is the sit to stand and the hip hinge. So again, 2 great strengthening exercises for our legs, our glutes, our back. And then exercise number 2, which is more focused on mobility, is the cat-cow or the cat-camel. So often I will give this exercise to people who report that they have a lot of stiffness in the morning in their back. This is a great exercise to really just get some movement happening in your spine. So again, I'll make myself big. So for this exercise, you can come down onto your hands and knees. You want your hands underneath your shoulders, your knees underneath your hips. And then you're going to be moving between 2 different positions. So the first one, you're going to roll your back up, pushing your belly button up towards the ceiling, hold for a second or 2, and then you're going to drop your belly button down towards the floor. And then you're just going to move back and forth between those 2 positions, keeping the arms straight so that, again, most of the movement is happening through your spine. All right. And again, we will go to the last set of exercises that I have for you guys, which is flexibility. So keeping good flexibility, good mobility in our muscles can be helpful to just lessen the strain on our low back. So regular stretching, these are 2 of my favorites. So we have Laura here doing the hip flexor stretch and Maggie doing the knee to chest. So again, 2 great stretches. I will quickly show you guys. So the hip flexor stretch stretches out the front of our hips, which can be very nice for someone if you do a lot of sitting, because your hip is going to be in this position for a long time. So with this exercise, you're going to step 1 foot in front of the other. Your back leg is going to stay nice and straight. You're going to be up on your toes. And I like to use either a wall or a chair here for some hand support. And then in this position, you're just going to shift your hips forward. So again, my front leg is bent, my back leg is straight, and then I'm shifting my hips forward to get a nice stretch through here. All right, and then you would switch and repeat the same thing on the other side. The second stretch, which stretches the low back muscles directly, you would come down onto your back and 1 leg at a time, grabbing behind the knee, you would hug your thigh into your chest. So again, feeling a nice stretch through there. All right. There we are. So again, guys, just a couple strengthening mobility and some flexibility exercises that could be helpful. Because again, we know movement is helpful. We know exercise is helpful for pain. However, it is super important to note, again, I think I said this 100 times, that everyone is different. So everybody's pain is different. So it is important to get an expert's input to determine what exercises could be helpful for you, how many, how often, when to do them, all of that stuff. So the takeaways, it is important to understand the multidimensional factors that influence back pain. Again, sleep, getting that 7 to 9 hours of sleep, your emotions, so having good coping factors, physical activities, your social supports, your emotions, stress, anxiety, all of those things all play a factor into back pain. And also, so you guys have the power to reduce your risk by implementing some simple strategies right now, by starting to incorporate some strength, mobility, some flexibility exercises just into your everyday life. Again, the goal here is to increase the load that your body can tolerate, so you can have an increased resilience when you're doing your day-to-day activities. And again, if you're going to take anything from today's presentation, it's that exercise can prevent, reduce, and rescue your low back pain. So how can Zoomers help you? If you do want a better understanding, or you still have questions, you want a closer look at your back pain, book an assessment with one of our physiotherapists. We will be more than happy to help you. And we also have a Club Z program here, which offers, it's a membership program, and it offers different fitness classes from a lot of different levels. So focusing on strength, balance, cardio. So again, a lot of the things included in those physical activity recommendations. Okay, and yes, stay connected with us. Check out our website, our Facebook, our YouTube. But otherwise, it was lovely chatting with you guys, and I hope to see you next time. Thank you.